Diabetes has obviously become one of the biggest health issues in the country. It just seems like it's exploded in the last 20 or 30 years. But obviously, we treat a lot of patients with diabetes, and it's very, very important to follow the recommendations, because if you do, then you will practically be able to have the same sort of lifestyle that you've always wanted. You can live within the parameters, and it's just a matter of committing to do it. And so we try to make sure we treat them with everything, all the resources that we have, from diabetic education to nutrition counseling, medications, and understand that it is a lifestyle change, but it's something they can live with. I don't want them to feel like it's a sentence. And so I spend a lot of time with patients when they first get diagnosed, explaining it, going over it, and kind of what their expectations should be. And we follow them up fairly closely and make sure that we're getting all the things done, from eye exams and feet checks and all those sort of things. Obviously, diabetes is very personal to me because I have a son with type 1 diabetes. And so when I have a patient that gets a new diagnosis of diabetes, it is very serious, but I do sort of bring that personal experience into it and let them know that, hey, I have a son with diabetes, and I have in-laws with diabetes. So we have type 1 and type 2. And so I know it can be a scary diagnosis, but I certainly help them understand that it's a diagnosis that they can live with, that they can make some behavioral changes, some dietary changes, and that it doesn't mean they can no longer, eat all the great things that they want to. We just have to make some accommodations, and I think they appreciate that. The fact that I'm coming from it from not only a medical standpoint, but from a father who's got a son with diabetes, and sees what it's like and knows what it's like on the inside and the outside.